Well, let's get the perspective of a junior doctor who will be taking part in the strike. Ben Dean is there for us in Oxford. Ben, good evening.
Good evening.
Why are you supporting an escalation of this?
I'm supporting an escalation because we haven't been listened to for several years now. If we had another viable option, we would definitely take it, because the last thing we want to do is strike. Repeatedly, the government hasn't genuinely negotiated, and they're trying to force through political soundbite at the expense of patients. I believe really strongly that the strike is something we have to carry through with at this stage, because the government's reforms are simply unsafe. Part of that is the contract reform, but this is obviously part of the bigger picture of the 7-day service reforms.
You saw Jeremy Hunt there saying that if the BMA had been prepared to talk about Saturday premium rates, as they had previously said they would, we wouldn't be in this situation.
I disagree with Mr. Hunt. The Saturday premium rate is only a small part of the package of shambolic disaster that this contract represents. There are several problems with the contract. The safeguards against excessive hours, which are dangerous for patients, are being watered down. That's one key aspect. The other key aspect is this contract addresses none of the problems we have with the current contract. It actually makes these worse. We don't want a rise in basic pay. We need the proper reward for antisocial hours to actually deal with the recruitment and retention crises we have in these specialties already, such as paediatrics, child health, accident and emergency, acute medicine. We've got huge rota gaps that are really quite dangerous at the moment. The current contract makes these problems worse. It's badly thought through. It's unsafe for patients. It's simply not acceptable for patients or for doctors.
Part of your argument, and you've just uttered it there, is the issue of patient safety. But surely by escalating the strike action to include emergency care, you are endangering that patient safety, aren't you?
I can see the argument, but I simply disagree. The service will be provided, emergency service will be up and running as normal, but without junior doctors. We'll have consultants and all the other healthcare team working, covering the emergency services as normal.
Consultants who would have been doing something else, presumably?
Yes, so there will be an impact on routine elective care, which we regret, and we obviously apologise to any patients affected by the action. But I think this short-term harm has to be done, really,
right. But with
for the long-term benefit.
But what about the public support issue, which you surely endanger here by stepping up the action?
I think the public support us at the moment, definitely, and I respect the public's view. They are completely entitled to take whatever view they wish, and I think the full information needs to be put to the public. And this is a problem all along with the 7-day reforms. They haven't been adequately defined. The evidence base is extremely poor. They've been proven to be cost ineffective. The contract still has not been risk assessed or impact assessed. Jeremy Hunt is effectively ignoring the Francis report, which recommended that any major service reforms should be adequately impact and risk assessed, and then those impact assessments should be debated in public prior to any implementation. This hasn't been done.
Forgive me for drawing things to a close, but time has beaten us. Thank you very much for coming on.
Thank you very much.
Ben Dean there in Oxford.